What, in your opinion, is the core message of integrative medicine? Is its goal to convince skeptics to open the conventional medicine door to complementary medicine therapies such as herbal medicine? Or else, is it a legitimate approach to healthcare which complements conventional medicine while keeping within the boundaries of scientific rigor and integrity? In this lesson, we will talk about the core ideas behind integrative medicine. Integrative medicine, which includes non-conventional treatments such as herbal medicine, has as its primarily goal the extension of perspectives and therapeutic tools of the healthcare practitioner. As with any field of medicine, integrative medicine strives to be based on rigorous research conducted in accordance with scientific methodologies. This approach does not agree with enthusiastic followers of non-evidence-based and usually unmonitored use of herbal remedies, who express the belief that if it's natural, it must be safe. At the same time, integrative medicine takes an open-minded skeptic approach which creates a non-judgmental discussion in which patients, whether using herbal medicine or considering its use, can address their beliefs and hopes from the non-conventional treatment. The context of this discussion needs to address the patient's health belief model and affinity to traditional medicine as it relates to their cultural or spiritual environment. This discussion will most often be initiated by the integrative physician, who will first need to clarify the context in which the patient is either using or interested in using herbal medicine products. In order to do this, the IP, the integrative physician, will need to ask the following questions. For example, in the treatment of hypertension and the use of garlic, is the patient interested in taking garlic pills in order to lower his blood pressure instead of the conventional medication that his family doctor has given him? If so, then the context of care is one of alternative medicine, requiring that patients choose this approach and not the use of conventional antihypertensive drugs. Is the patient taking the garlic pill in addition to the antihypertensive medication, with the hope that this will make it possible for him to take a lower dose of the drug? This would then be a context of complementary medicine. In a third scenario, the patient's physician recommended that he also use garlic in addition to the conventional medication. This recommendation was part of a multimodal effort to control blood pressure levels as well as other risk factors which may be reduced with the use of garlic, such as elevated cholesterol levels. The third scenario is one of integrative medicine. The next stage of the interaction between the patient and integrative physician will be to explore the patient's expectations from the non-conventional therapies within the broader perspectives of the patient's narrative. At the end of the discussion about beliefs and therapeutic options, the integrative physician and patient can then co-design an integrative treatment plan, recruiting the best of both worlds. This process can also involve the patient's entire circle of healthcare providers, including the oncologist, nurse, surgeon, etc. The integrative medicine treatment plan will have clearly defined goals, both general and specific, symptom-directed. The integrative physician can thus serve as a gatekeeper and case manager, addressing three main aspects of the therapeutic process. First, the context medical care as it relates to the patient's narrative, expectations, health belief model, as well as the more broad biopsychosocial spiritual context in which the question of who I am and what do I hope for are defined. The second aspect concerns the scientific evidence available vis-a-vis the effectiveness and safety of the herbal and other non-conventional treatment options being considered. The third aspect needs to address the establishment of effective communication in which the patient, their caregiver, and the integrative physician can participate within a broader circle which is shared by a multidisciplinary team of conventional and complementary medicine practitioners. Professor Aviada Ramati from Georgetown University Medical School in Washington, D.C. has defined doctor-patient communication as a core concept of integrative medicine, calling for what he has termed a non-judgmental, open-minded skepticism. In the following interviews, Professor Moshe Frankel and Dr. Elad Schiff further discuss the role of communication in integrative medicine within the triad of the patient, the conventional healthcare provider, and the integrative medicine provider.
We're looking more at not just following a very algorithm type of medicine, but trying to be more in tune with what is going on with the patient. So this is what we are looking at, what we feel is patient-centered care, where the patient is in the center and we're trying to address their needs according to what they're looking for and seeing if some of the things that they are looking in integrative medicine, traditional medicine, we can integrate into the realm of their care.
But how you create an atmosphere that is more open or non-judgmental on one hand, and on the other hand oriented to science, to concepts of effectiveness, of safety? How do you
combine
that?
It's very tricky. First of all, you have to understand that the first and a very important part is actually you have to listen to the patient. You have to see what their needs are. And then from there, you start building some kind of a plan that actually addresses their specific needs and what they're looking for in what they look in the interactions that they come for.
We have Tai Chi and Qigong experiences every day in each of the 12 departments where we have integrated medicine. So every day at 11 a.m., patients raise from their beds, go to the center room of the department and start to practice Tai Chi. This is an amazing experience to see patients with tubes, with IV lines, with open scars, going and changing their mode of thought from being patients who are passive into people who are taking active care of themselves. And this is a beautiful picture where not only the patients participate, but also their family and also the hospital staff join. So there's a role model there. And I want just to highlight this aspect of the important role of movement therapy in the hospital setting.